Are you wondering if you should take prednisone for an ear infection? Hi, I'm Dr. Megan, your prednisone pharmacist, and I'm personally dealing with an ear infection right now. So I definitely understand your concerns and questions. So prednisone is this amazing medication that I've personally had to take in the past to save my life, but it wasn't for an ear infection. Prednisone can be used it's an anti-inflammatory benefit for inflammatory conditions like arthritis. It can help with autoimmune conditions like rheumatoid arthritis and for things like asthma. And it is a really helpful medication. However, it comes with a lot of side effects. So if you have an ear infection, should you take prednisone along with it? Well, I did a lot of research and I cannot find any studies showing that you should. The best medical reference for doctors and pharmacists like me is up to date. And when I looked through its treatment algorithm, it did not include prednisone or dexamethasone or any other steroid when treating ear infections. The mainstay of therapy is antibiotics. I personally was given amoxicillin. You could be given Augmentin, which is amoxicillin with a little thing on the side called clavulanate, or you could be given other things if you're allergic to penicillin. But prednisone is typically not given along with amoxicillin for ear infections. And that's because of what I mentioned earlier, that prednisone causes a lot of side effects, potentially more side effects than any other drug. And so you don't want to have insomnia and weight gain and broken bones and other infections because you're taking prednisone if it's not absolutely necessary. On the other hand, some doctors recommend nasal steroids to help with the congestion and fullness that can lead to ear infections. And so that is a possibility if you wanted to use a nasal spray like fluticasone that may potentially decrease the swelling and inflammation that is leading to the ear infection. So, as far as I can tell, the only studies that have ever been done were in mice, and they were a long time ago. So, I don't know if there's any other newer research, I can't find any, that shows that prednisone is helpful. But generally, ear infections go away on their own, especially in children. Generally, ear infections are viral, and so you don't need antibiotics unless the ear infection keeps causing pain for more than 24 hours and it's associated with a fever in children, things like that, then you would want antibiotics. For me, I had severe pain for more than 2 days. I definitely needed an antibiotic. And so they gave me one. But did I need a steroid? Likely not. And unless your doctor has another good reason for using prednisone for your ear infection, I'm not seeing any reason you should use it. Prednisone is often given as like the last resort. Hey, you've got some weird pain. I don't know what to deal with. Here, have some prednisone. And it doesn't necessarily mean that there's any evidence to support it. So unless your doctor has another reason or evidence to support using it, then I personally, if my doctor said, here's prednisone and amoxicillin, I would have been like, okay, thanks, I'll take the amoxicillin, and I would not take the prednisone. Definitely work with your doctor and find out specifically. It's important that you always know the benefits and the risks. And when it comes to ear infection, I'm not seeing any benefits at all, and I'm seeing a ton of risks. So to me, it's tilting way in the benefits don't outweigh the risks for this situation, unless you know more about benefits for you. Talk to your doctor. Otherwise, if you found this video helpful, please like this video. And then if you have taken prednisone for an ear infection and you found it helpful, please let us know your experience below. Signing off as Dr. Megan, your prednisone pharmacist.